Okay, so here we are at 532 and a half, see the half? Dragon Alley. And we're going to go see Marlin Wilson. Marlin Wilson practices traditional Chinese medicine, and what an amazing place to practice Chinese medicine. Follow me. So Marlin, I understand you practice traditional Chinese medicine. I'd like to hear what got you involved in that area of medicine, because I find it fascinating, and what it is that you focus on.
Well, I'm a doctor of traditional Chinese medicine, so I do acupuncture, herbology, massage, mostly. Also, I got started in it when I was pretty young. I was drawn to the mystery and the usefulness of the medicine, and began with acupressure and massage techniques, and then eventually went to school to learn how to do the acupuncture.
When I was being treated by you, and one of the things that you started in terms of interviewing me and getting to know me was examining my tongue. Why did you do that, and how do you do that?
Well, it's centuries of observation when we've learned that the tongue changes in response to the conditions within the body. So as the body changes, so does the tongue. You can see kind of the history of the changes of the body on the tongue. So we look at the tongue, determine what condition the body's in, and then we use the medicine to reverse those changes and put the body back to normal, which is a state of health.
So when you say the medicine, you're referring to acupuncture or herbology, or what you consider to be appropriate to find that position of wellness?
Well, here at Wilson Acupuncture, we use a variety of techniques to determine that, and they're all complement and reinforce each other, so they go together. So we would also take your pulse, look at your tongue, ask you questions, and determine what the problem was, and then choose the right type of medicine to address that specific problem. And over the years, I've learned to treat people very individually and to completely focus on their problem and use that aspect of the medicine that addresses their needs the most effectively.
Okay. Can we go check out your acupuncture area?
Sure.
Okay.
So a minute ago we were talking about pulse and tongue diagnosis. So if you wouldn't mind, I'd like to take your pulse, and I'm listening to the rhythm and the speed, the width, the depth, the size, the force, the pressure of the pulse, all those things. And then as I'm doing that, I like to look at your tongue. So if I may, I'll get you to just stick your tongue out.
Here we go.
Open your mouth. Yeah, and relax your tongue. Don't move it. Okay. And then you can bring it in again. Perfect. Thanks very much. That's it.
I'm not used to sticking my tongue out at people, but
yeah.
It's okay.
It takes a bit of getting used to. So, and now I'd like to do the other one because they're different.
This is my good side.
This is your good side. Okay. And so again, I'm feeling the various pressures and the type of pulse and the rhythm of the pulse.
So how many pulses do I have from your perspective when you're assessing me?
Well, you really only have one pulse, which comes from your heart, but we categorize it into, is it a strong pulse or a weak pulse, a fast pulse? Is it a tense pulse? Is it a sinking pulse? So we categorize it into 21 different categories of pulse.
Now, you also do acupuncture. In fact, I'm on your acupuncture table.
Yes, this is an acupuncture table.
Okay, so I'd be interested in getting a little sort of an overview about how you do acupuncture and why you do acupuncture.
Well, the fun part for me is I think we ought to do a demonstration, and you could be.
Goody. Okay, I'm all.
Well, you've had
all for
acupuncture before,
yeah,
so
show me.
Okay.
I'm in your hands.
All right. So this is an acupuncture needle. You can see it's a surgical stainless steel, copper wrapped handle. Some of them are silver, some of them are even gold. And after they're in, you get a intense feeling of like inner health, or the movement of healthy energy. So you feel very healthy and very relaxed. So here's the first one. So I'm about to put it in right now. Ready? 1, 2, 3. And how was that on a scale of 1 to 10 for sensation?
Yeah, that was just fine.
Great. Okay, so we're going to do this, the second point right here. And we'll even do a third point. So then the needles are very flexible, as I say. See, I'm bend that right over. It's not hurting. Is that causing you any distress?
Not particularly, no.
So the needles are very flexible. When you take them out, very interesting. I'll take one out. There's no visible mark on the skin, so they're actually so fine. They go between the pores. Don't do any harm to the patient. So remember when we were upstairs, we were talking about the acupuncture was just one aspect of a complete holistic system of medicine. Herbology is the other. And so these are the herbs. I'll show you one. This one is called Jingji. And it's a plant-based medicine, very aromatic.
Does it have smell?
Yes, it has
Aromatic.
a very wonderful smell.
It does, actually.
It's good for many skin problems. And then so what we do is we have many different herbs, and based on the many types of diagnosis that we put together, so we make a herbal formula, which is a bunch of herbs all put together like that. So this represents 10 or 12 different herbs all put in one package.
And does this become a tea or?
Yeah, so what we would do is we would put this into a pot with about 6 cups of water and bring it to a boil with the lid on it. And then we would turn it down to simmer for about 20 minutes and strain it out. We'd get 4 or 5 cups of tea out of it. Very strong, difficult to drink because it doesn't taste like a typical...
It's not honey lemon ginseng.
It's not honey lemon ginseng, but it is very powerful for your health. And we use it on cancer, stroke, migraine, headaches, skin problems, stomach problems, back pain. So the formulas can be quite different based on the different herbs that we use.
So I want to thank you. This has really been interesting to learn about herbology, to experience some acupuncture, and to have somebody look at my tongue.
I know it's all a bit new and unusual, but it was such a pleasure to see you.
Well, thank you so much.
Yeah, you're welcome.